As supporters of public health, we realize how important your child's safety is to you. To help you and your family make the safest medical decisions, we present to you the validity of vaccines.
At the moment, there are several misconceptions floating around about vaccines, such as the idea that the measles, mumps, and rubella vaccine causes autism, when in reality, autism is diagnosed around the same time children receive their vaccines. This correlation is what led discredited scientist Andrew Wakefield to put out false reports from a study. In 2009, he confessed to having no evidence linking the MMR vaccine to autism. Also, modern medicine has expanded the list of diagnosable symptoms for autism, resulting in a larger number of children being diagnosed.
People also believe that if a young person receives the HPV vaccine, they will be encouraged to engage in intercourse. On the contrary, everyone will eventually have intercourse. This vaccine will help prevent the transmission of HPV, which can cause cervical cancer, uterine cancer, and STDs. Although it seems counterintuitive to put foreign substances in your body to protect it, vaccines would not be approved for use by the general population by the FDA if they were unsafe or caused any kind of disease.
We are reaching out to parents of small children just like you, asking that you take a minute to consider the consequences of not vaccinating your child. Your child could contract deadly diseases because they do not have basic immunity from the preventable disease, or your unvaccinated child could spread a deadly disease to someone who cannot be vaccinated, such as someone with an autoimmune disease.
In 2017, 1.3% of 2-year-olds had not received any vaccinations. In less developed countries, people do not have the same access to vaccines like we do. This means that 1.3% of all 2-year-olds in 2017 were more susceptible to infectious diseases than the kids that were vaccinated if they came into contact with someone who had been exposed to a virus. Deadly viruses have been epidemically spreading around the world, making this hypothetical encounter more likely than if the breakout was contained.
Herd immunity is the ultimate goal for the population. Herd immunity will be reached once the majority of people are vaccinated. This will create a safe environment for our community's most vulnerable populations, including pregnant women, infants, the elderly, and people with immune diseases. They will not be susceptible to contracting a disease from a carrier or an affected person.
The earliest your child can be vaccinated is at birth with the hepatitis B vaccine, and most vaccines are scheduled around the baby's second month. Reach out to your primary care physician or your local clinic for more information. Also, if you are unsure if you want to vaccinate your child or not, consider reading more about the issue on the NCBI's website.